14 a.m. March 7th, 2023. Garland, Texas. A column of black Chevrolet Suburbans rolls through a quiet residential neighborhood in Dallas County. The lawns are trimmed. The driveways hold late-model sedans. A school bus stop sign sits on the corner, unmoved by what is about to happen 40 yards away. 12 federal agents step onto a brick-front Colonial. The warrant is signed. The Ram is ready, but they don't need it. The front door opens. Standing in a bathrobe, coffee mug in hand, is a woman who, on paper, is one of the most compassionate healthcare providers in the North Texas region. A woman whose company literature promises dignity in life's final chapter. A woman whose smiling photograph appears on brochures distributed to nursing homes, assisted living facilities, and churches across 4 counties. Her name is Eligio Tina Emba. And the FBI has come to dismantle everything she built, because none of it was real. The investigation didn't begin with a tip. It didn't begin with a disgruntled employee or a suspicious family member filing a complaint. It began the way so many federal healthcare fraud cases begin, with numbers that didn't add up. Analysts at the Department of Health and Human Services Office of Inspector General had been running pattern recognition algorithms across Medicare billing data in the North Texas region. The system flagged an anomaly. A hospice provider, registered under the name Savannah Hospice Care, LLC, was billing at rates that defied statistical probability. The average hospice provider in Texas serves a certain volume of patients per quarter, with billing patterns that correspond to documented levels of care. Savannah Hospice Care was billing for continuous home care at nearly 4 times the regional average. Continuous home care, known in the industry as CHC, is the highest reimbursed level of hospice service Medicare offers. It requires a nurse or aide to be physically present with a dying patient for a minimum of 8 hours in a 24-hour period during acute medical crises. It pays approximately $1,100 per day. Per patient. Savannah Hospice Care was billing CC for dozens of patients simultaneously. Week after week, month after month, the math was staggering. And impossible, because Savannah Hospice Care did not have the staff to provide continuous care to that many patients. It didn't have the infrastructure. It didn't even have the medical supplies. What it had was a billing department. And a married couple willing to fabricate everything else. Eligio Tina Emba and her husband, Christopher Emba, had founded Savannah Hospice Care in 2017. On the surface, the operation looked legitimate. They secured a Medicare provider number. They leased office space in a modest commercial plaza off Interstate 30. They printed professional marketing materials and dispatched recruiters to nursing homes, rehabilitation centers, and low-income senior housing complexes. The recruiters were not looking for patients who were dying. They were looking for patients who could be documented as dying. This is the architecture of the fraud. Federal investigators would later describe it as one of the most brazen hospice schemes they had encountered in the Northern District of Texas. The Embas recruited Medicare beneficiaries, many of them elderly, many of them non-English speaking immigrants, many of them suffering from chronic but manageable conditions, and enrolled them in hospice care they did not need and would not receive. To qualify for Medicare hospice benefits, a patient must be certified by a physician as having a terminal illness with a life expectancy of 6 months or less. The Embas had a solution for this requirement. They paid physicians and nurse practitioners to sign certifications without examining the patients. In some cases, the certifying clinicians never met the individuals whose death sentences they were endorsing on paper. One patient, a 71-year-old woman enrolled by Savannah Hospice, was documented as being in the final stages of congestive heart failure. She was, according to investigators, walking independently, managing her own household, and attending church 3 times a week. Another patient, a man in his 60s, was certified as terminally ill with end-stage liver disease. Medical records obtained by federal agents showed no clinical evidence supporting the diagnosis. They weren't dying. But on paper, for billing purposes, they were. The scale of the fabrication required a system. The Embas built one. Nurses and aides were hired, some credentialed, some not, and instructed to document care that was never delivered. Visit logs were fabricated. Vital signs were invented. Notes describing symptom management, pain interventions, and emotional support sessions were written about encounters that never occurred. In the most egregious tier of the scheme, continuous home care was billed for patients who were not in medical crisis, were not being monitored, and in several documented instances were not even home when the supposed 8-hour nursing shifts were taking place. The billing system generated claims automatically. The claims went to Medicare. Medicare paid. Between 2018 and 2022, Savannah Hospice Care submitted approximately $7.4 million in fraudulent claims to the Medicare program. Federal investigators determined that the vast majority of those claims, the precise figure cited in court documents is over 90%, were for services that were either never provided, not medically necessary, or both. $7.4 million. Extracted from a program designed to comfort the dying, stolen through the systematic fabrication of terminal illness and phantom care. But the numbers, as devastating as they are, do not capture the full scope of the damage. Because there were real patients. Patients who were genuinely ill. Patients who were enrolled in Savannah Hospice Care and who actually needed the services that were being billed for but never delivered. This is where the fraud becomes something worse than theft. This is where it becomes abandonment. Federal investigators and subsequent state health department reviews uncovered cases in which patients with legitimate terminal diagnoses were enrolled in Savannah Hospice and then effectively ignored. Their care plans existed on paper. Their medications were documented as administered. Their comfort was recorded as maintained. But no one came. No nurse arrived to manage the pain of a woman with metastatic cancer in her home in Mesquite. No aide helped a bedbound man with end-stage COPD in his apartment in South Dallas. No social worker checked on a family struggling to manage a loved one's final weeks without training, without equipment, without support. The care was a ghost. The billing was real. Impact statements submitted during later proceedings described families discovering the truth only after their loved ones had died, learning that the hospice company they trusted had never sent the personnel it claimed, never provided the medications it billed for, never delivered the around. The clock monitoring it documented in records submitted to the federal government. One family member's statement, read into the record, contained a single line that federal prosecutors would later cite in their sentencing memorandum. "My mother died alone because someone decided her death was worth more as a transaction than as a life." The investigation accelerated through 2022. Haig's OIG agents, working alongside the FBI's Dallas field office and analysts from the Centers for Medicare and Medicaid Services, executed a series of coordinated actions designed to map the full scope of the operation before moving to arrest. They subpoenaed banking records. They reviewed thousands of pages of medical documentation. They interviewed former employees, some of whom cooperated, others who initially denied knowledge before confronting the weight of evidence against them. The financial trail was damning and direct. Funds from Savannah Hospice Care's Medicare reimbursements flowed into accounts controlled by the emboss. From those accounts, investigators traced expenditures that bore no relationship to patient care. Luxury goods, vehicle purchases. Personal real estate investments. The proceeds of fabricated death were funding a lifestyle built on the suffering of the vulnerable. Agents also discovered that the emboss had taken steps to obstruct the investigation once they became aware of federal scrutiny. Records were altered. Employees were coached on what to say if contacted by investigators. In at least one documented instance, patient files were modified after subpoenas had been issued, a federal offense carrying its own severe penalties. The arrests came on the morning of March 7th, 2023, coordinated. Simultaneous. The kind of operation the FBI executes when it wants to ensure no one has time to run, destroy evidence, or coordinate stories. Eligio Tina Emba was taken into custody at her Garland residence. Christopher Emba was arrested at a separate location within the hour. Additional individuals connected to the scheme, including medical professionals who had signed fraudulent certifications and employees who had participated in the documentation of fictitious care, were detained or served with notices to appear. The indictment, unsealed that afternoon, laid out the charges with the methodical precision of an agency that had spent years assembling its case. Conspiracy to commit healthcare fraud. Healthcare fraud. Making false statements relating to healthcare matters. Conspiracy to pay and receive healthcare kickbacks. Obstruction. The Department of Justice held a press conference in Dallas. The United States Attorney for the Northern District of Texas stood at a podium flanked by representatives from the FBI and Hates OIG. The statement was direct. This case represents a fundamental betrayal of one of the most sacred responsibilities in healthcare: the care of individuals at the end of their lives. The defendants exploited the Medicare hospice benefit, exploited vulnerable patients, and exploited the trust of families during their most difficult moments, all for personal financial gain. The FBI special agent in charge added a sentence that would be quoted in regional and national reporting for weeks. They turned hospice into a harvesting operation. The legal proceedings moved with the deliberate weight of the federal system. Motions were filed. Discovery was exchanged. The evidence was overwhelming, not just in volume, but in the clarity of its narrative. Every fabricated visit log, every forged physician certification, every bank transfer from a Medicare-funded account to a personal luxury purchase told the same story. There was no ambiguity. There was no gray area. There was only the systematic conversion of human suffering into revenue. Under federal sentencing guidelines for healthcare fraud of this magnitude, the emboss faced the possibility of decades in prison. The conspiracy charge alone carried a maximum of 10 years. Each count of healthcare fraud carried a maximum of 10 years. The obstruction charges layered additional exposure. Restitution orders were sought for the full $7.4 million. Asset forfeiture proceedings targeted properties and accounts linked to the fraud proceeds. The financial architecture the emboss had built over 5 years was dismantled in a matter of months. The Savannah Hospice case is not an outlier. It is a symptom. The Medicare hospice benefit, established in 1982 to provide comfort care for terminally ill patients, has become one of the most exploited programs in the federal healthcare system. The Office of Inspector General has documented a pattern of fraud that stretches across states, involves hundreds of providers, and costs taxpayers billions of dollars annually. The structure of the benefit, its reliance on physician certification, its high reimbursement rates for continuous care, its limited prepayment verification, creates vulnerabilities that criminal operators have learned to exploit with increasing sophistication. In 2020, the OIG reported that Medicare spending on hospice exceeded $22 billion. A significant and growing percentage of that spending, according to the agency's own assessments, is attributable to fraud, waste, and abuse. The continuous home care category, the same billing code the emboss exploited, has been flagged repeatedly as disproportionately vulnerable to fabrication. The patients most affected are those with the least power to advocate for themselves: the elderly, the isolated, the non-English speaking, the cognitively impaired. They are enrolled by recruiters who promise comfort and deliver nothing. Their names become line items on billing spreadsheets. Their diagnoses become currency. And when they die, as some of them inevitably do, because some of them are genuinely sick, they die without the care that was billed in their name, paid for by their government, and pocketed by someone who never intended to provide it. The Garland neighborhood returned to its quiet rhythms within hours of the raid. The school bus came, the lawn stayed trimmed, the brick front colonial sat empty, its occupants in federal custody, its purpose revealed. $7.4 million. Dozens of patients. Years of fabricated care. One couple who looked at the end of human life and saw nothing but a revenue stream. The system caught them. This time, but the question that lingers, the question that should concern every taxpayer, every family with an aging parent, every policymaker with oversight authority, is how many operations like Savannah Hospice Care are still running right now. Still billing. Still fabricating. Still collecting. still leaving patients to die alone.